It is important to understand that autologous stem cell therapy is a technique where body's own stem cells are taken from the bone marrow, right? So as you can see, we will be taking out some amount of stem cells from the bone marrow. Typically, it is taken out from the waist bone. As a patient, you just need to know this much, right? This is done by a orthopedic, a doctor who specializes in bone health, okay? Once we take out the stem cell, there is a particular time window which is related to the clotting time and bleeding time of the patient along with the other blood parameters where we need to take this for processing. See, please understand, at this moment, this therapy is considered to be an experimental therapy. Why is it experimental? Because right now, we do not know which is the best potential stem cell for the uterus or for the ovary. Because we don't know, what we try to do, all what we think are progenitor cells, we take them with a series of processing steps. These are called as steps for filtration.
We have aspirated the marrow from the patient whose stem cell therapy we are going to conduct. Now already we have this brushless motor centrifuge. We will rotate it at the speed of 3000 RPM for at least 15 to 20 minutes, and we will separate out the cells so that we can have the marrow aspiration, and especially the buffy coat area will be taking into the consideration. Removing the cap for the separation.
Where all the impurities of the blood get taken out and only the mixture which contains the most potent stem cells, which is also called as progenitor cells, they would remain. Now after you select these progenitor cells, that is when you get them up, go back to the operation theatre, and then you put them either inside the uterus or in the ovary, or in the uterus and the ovary both, depending on the parameters of the patient. That is very important. Alright. In the ovary, it is a more resistant organ. The outcomes are poorer. The outcomes of injection of stem cells in the ovary usually does not cross 10 to 15%. And there is a strict selection criteria for that. Till we step into the future, where we will get permission to culture these stem cells after isolation, that is when we will be able to give excellent outcomes of this therapy, and very, very good outcomes even to women who are nearing ovarian failure, even to women who have very minimal amount of endometrium remaining, so that they can become pregnant with their own eggs in their own uterus, even after crossing a certain threshold of age. I hope you find this video useful. Thank you so much.